The healthcare debate continues on Capitol Hill, and donations roll in to an all-time high for Meals on Wheels. It happened in broad daylight. Now what? A shooting at a local convenience store shakes a small town in Mississippi. We've got a lot to talk about this morning. Your top 4 and 4 countdown starts right now. Starting with headline number 4, Supreme Court nominee Neil Gorsuch faced hours of questioning from senators as frustrated Democrats are determined to press him on everything from abortion and guns to his independence from President Donald Trump. Republicans are unanimously supporting Gorsuch and certain to give him what cover they can as he appeared before the Senate Judiciary Committee for his confirmation hearings on Tuesday. But Democrats made clear on the first day that they were in no mood to, quote, rubber stamp a nominee by President Trump, seeking to take the edge off Democratic complaints that he has favored the wealthy and powerful in more than 10 years as a federal judge. The 49-year-old Coloradan said he has tried to be a neutral and independent judge. We are rolling along to headline number 3. Meals on Wheels received 50 times the typical amount of daily donations on Thursday after the White House proposed cuts to some of the program's sources of funding. Volunteer signups also jumped, increasing by 500%. That according to a spokeswoman for Meals on Wheels America. Several local Meals on Wheels organizations said they have received similar support. The outpouring of support comes shortly after the White House's budget blueprint suggested eliminating the $3 billion Community Development Block Grant Program and cutting funding for the Department of Health and Human Services. Those programs constitute sizable funding for Meals on Wheels, a nonprofit with more than 5,000 local branches that provides hot meals and support for about 2.4 million senior citizens. Well, here it is, headline number 2. President Donald Trump is threatening to leave Obamacare in place and move on to other issues if a House vote on a Republican placement health care plan fails today. The outcome of the plan vote is impossible to predict right now. Even after long days of talks Thursday, both conservative and moderate lawmakers claim the bill lacked the votes. There may be enough votes to narrowly defeat the measure when it comes up for a vote today. The good news about the bill is it spends less on fewer subsidies, reduces Medicaid spending by large amounts, and uses the savings to eliminate taxes on wealthier Americans and medical companies imposed by the ACA. It would reduce the deficit by $337 billion over the next decade, according to the nonpartisan Congressional Budget Office. Well, here's a look at who gets helped and who gets hurt in the GOP-backed health care bill. Older patients with low incomes will see big spikes in their premiums, along with higher deductibles and out-of-pocket costs, especially if they live in rural areas where care tends to be more expensive. For instance, a 64-year-old making $26,500 annually would pay an average of $12,900 more per year in premium costs. That according to the Congressional Budget Office. And their insurance would not cover as much. So if you have a lower income, you too will be affected. Your premium could also go up. As far as who the bill helps, younger, healthier patients will see cheaper insurance policies and tax credits for the wealthy. And finally, headline number 1, a local story that rocked us all early this week, the shooting in downtown Columbus. This was the scene early Sunday morning. The gunfire erupted after midnight on 5th Street South between the Princess Theater and the Fred's department store. There were 5 vehicles hit that night. 2 of them were occupied. And if that wasn't enough to make us fear for our safety, then this happened a couple days later. 2 men shot at OK Foods convenience store in Columbus on 7th Street. The incident did not happen at night, but in broad daylight. In the police report, one of the victims was shot in the arm, leg, and neck. Well, according to the Journal of Trauma and Acute Care, in the United States, someone experiences a gunshot wound every 4 minutes and 44 seconds. And as the victims pile up in these types of crimes, so do the costs. According to a study released Tuesday in the American Journal of Public Health, between 2006 and 2014, the costs and financial burden of firearm injuries in the U.S. reached over $6.5 billion. Now, if you break down that number even further, we spend over $700 million a year paying for these hospitalizations. And one part of this story that doesn't have a value, a price tag, or some type of monetary worth is human life. And if these 2 incidents aren't examples of a blatant disregard for humanity, I don't know what is. There really are no words. We'll be right back with more Sunrise after this.